Welcome back to our channel, where we share important health knowledge and effective self-care tips. Today, we will explore the early signs of kidney failure after eating. Kidney failure is a serious issue, but if recognized in time, you can prevent and treat it effectively. The kidneys play a crucial role in filtering out toxins from the body, maintaining electrolyte balance, and regulating water levels. When kidney function declines, the body sends early warning signals. However, these signs are often very subtle and easy to overlook, especially after eating. In this video, we will analyze each symptom in detail so you can recognize and understand how the body signals kidney problems. Stay tuned to grasp these important insights, which will help you protect your health and that of your loved ones. Let's get started. 1. Feeling nauseous or vomiting. Feeling nauseous or vomiting after eating can be a silent sign of kidney failure that we often overlook. When the kidneys are not functioning effectively, toxins and waste products are not filtered out of the blood, leading to accumulation in the body, causing nausea. Additionally, kidney failure disrupts the balance of electrolytes such as potassium, sodium, and calcium, causing this discomfort. The condition where urea and other waste products are not removed can also irritate the stomach lining, making you feel nauseous after eating. This is often accompanied by loss of appetite, bloating, and indigestion. To manage this, you should change your diet, avoid hard-to-digest foods, and eat several small meals. Taking medications as prescribed by your doctor and maintaining food hygiene is also crucial. 2. Loss of appetite. When you lose interest in food right after starting to eat, it could be a sign that your kidneys are having problems. When the kidneys are not functioning effectively, toxins and waste products are not filtered out of the blood, leading to accumulation in the body and affecting your appetite. The imbalance of chemicals and electrolytes such as potassium, sodium, and calcium due to kidney failure can also alter your taste and reduce your interest in food. Additionally, the buildup of urea in the blood, called uremia, can cause nausea and loss of appetite. Anemia due to reduced production of the hormone erythropoietin by the kidneys also reduces energy and appetite. Kidney failure can also cause stress, anxiety, and depression, further reducing your appetite. 3. Feeling bloated. Feeling bloated or experiencing indigestion after eating can be a silent sign of kidney failure that we often overlook. When the kidneys are not functioning effectively, toxins and waste products are not filtered out of the blood, leading to accumulation in the body and causing bloating and indigestion. Kidney failure also disrupts the balance of electrolytes such as potassium, sodium, and calcium, affecting the activity of the stomach and intestines. This can slow down the digestive process and cause discomfort after eating. Additionally, urea and other breakdown products that are not eliminated will accumulate in the blood, causing a condition called uremia, which increases stomach discomfort. Don't forget to like, share videos and subscribe to the channel so you don't miss out on useful health information from us. 4. Feeling fatigued. Feeling fatigued and weak right after a meal can be a silent sign of kidney failure that we often overlook. When the kidneys are not functioning effectively, toxins and waste products are not filtered out of the blood, leading to accumulation in the body, causing fatigue and weakness. Kidney failure can also cause anemia due to reduced production of erythropoietin, a hormone necessary for red blood cell production, reducing the oxygen supply to tissues and organs, causing fatigue. Additionally, the imbalance of electrolytes such as potassium, sodium, and calcium in the body affects muscle and nerve function, leading to fatigue and weakness. When kidney function is impaired, the body's metabolism is also affected, reducing energy levels and causing fatigue after eating. To manage this, you should eat several small meals throughout the day with easily digestible and nutritious foods, and do light exercise after meals like walking. 5. Change the taste. Feeling that food tastes different or losing your sense of taste after eating can be a silent sign of kidney failure. When the kidneys are not functioning effectively, toxins and waste products are not filtered out of the blood, leading to accumulation in the body and affecting taste. The buildup of urea and other waste products in the blood can cause a metallic taste in the mouth or alter the taste of food. Kidney failure also disrupts the balance of electrolytes such as potassium and sodium, affecting taste function. Dry mouth is another common cause, reducing the ability to taste food. To manage this, you should try different foods, drink enough water to keep your mouth moist, use spices to enhance flavor, and consult a doctor if needed to check kidney function. 6. Dry mouth. Dry mouth after eating can be caused by the kidneys not removing enough water from the body, leading to a feeling of dryness and discomfort. This is a subtle but important symptom of kidney failure. The kidneys regulate the amount of water in the body, and when kidney function declines, the ability to remove excess water and waste is affected, leading to the accumulation of water and waste in the body. When the kidneys do not work effectively, wastes such as urea and creatinine build up in the blood, causing a dry mouth and discomfort. Decreased kidney function also leads to an electrolyte imbalance in the body, affecting the salivary glands and causing dry mouth. The feeling of dryness and stickiness in the mouth, especially after eating, makes chewing and swallowing difficult. Dry mouth can make it difficult to talk and cause a constant feeling of thirst. Dry mouth is often accompanied by bad breath due to the accumulation of waste products in the blood. Lack of saliva can cause cracked lips and gum inflammation, increasing the risk of mouth infections. 7. Bad breath. Bad breath, especially after eating, can be a sign of the accumulation of urea in the blood due to decreased kidney function. The kidneys are responsible for filtering urea and other waste products from the blood into the urine. When the kidneys are not working effectively, urea is not removed and begins to accumulate in the blood. Urea in the blood breaks down into ammonia, causing a foul odor in the breath. The breath smells like ammonia or has a fishy odor, often more noticeable after eating or in the morning upon waking. People with kidney failure often experience dry mouth and a metallic taste due to the accumulation of waste products in the blood. Bad breath can be accompanied by other symptoms of kidney failure such as fatigue, nausea, loss of appetite, and swelling in the legs, hands, and face. 8. Nocturia. Nocturia is the frequent need to wake up at night to urinate, especially after eating dinner, and it can be a silent sign of kidney failure. When the kidneys are not functioning effectively, the body's ability to filter and remove waste decreases, leading to increased urine production, especially at night. Weakened kidneys cannot concentrate urine effectively, causing the body to produce more urine at night. Fluid accumulation in the body due to the kidney's inability to efficiently remove excess water and waste is a primary cause of nocturia. Kidney failure also disrupts the balance of electrolytes such as sodium and potassium, affecting water regulation and increasing the need to urinate at night. High blood pressure can also increase pressure on the kidneys and urinary system, causing this condition. 9. Foamy urine. Noticing foamy urine or unusual urine color after eating can be a silent sign of kidney failure. When the kidneys are not functioning effectively, they cannot filter out waste products and proteins efficiently, leading to changes in the urine. Proteinuria, the presence of protein in urine, can cause foamy urine. Kidney failure can also damage small blood vessels in the kidneys, leading to blood in the urine, changing its color to pink, red, or brown. Additionally, when the kidneys cannot efficiently remove waste products, these substances can build up and change the color of the urine. An imbalance of electrolytes such as potassium and sodium can also affect the color and appearance of urine. 10. Lower back pain. Lower back pain or side pain, especially around the kidney area after eating, can be a silent sign of kidney failure. When the kidneys are not functioning effectively, they have to work harder to filter out waste and toxins, causing stress and pressure on the kidney tissues, leading to pain. Kidney failure can also increase the risk of urinary tract infections, causing inflammation and pain in the kidney area. Additionally, kidney failure can lead to the formation of kidney stones, causing lower back or side pain, especially after eating. When the kidneys cannot remove excess water and waste, fluid accumulation in the kidneys can cause pressure and pain. To manage this, you should drink enough water to help the kidneys function more effectively and reduce the risk of kidney stones. Adjust your diet by limiting salt and protein. Engage in light exercise such as walking to improve blood circulation and reduce lower back or side pain. 11. Edema. Edema is swelling in the legs, ankles, or hands after eating due to fluid retention, and it can be a silent sign of kidney failure. When the kidneys are not functioning effectively, they cannot remove excess water and salt from the body, leading to fluid accumulation in the tissues and causing edema. This accumulation can also cause an imbalance of electrolytes such as sodium and potassium, affecting water regulation and causing swelling. Impaired kidney function can also reduce the production of albumin, an important protein that helps keep water in the blood vessels, causing water to be pushed out of the blood vessels and accumulate in the tissues. Kidney failure can also lead to high blood pressure, increasing pressure in the blood vessels and causing edema. 12. Feeling short of breath. Feeling short of breath or experiencing rapid breathing after eating can be a silent sign of kidney failure that we often overlook. When the kidneys are not functioning effectively, the body tends to retain water and salt, increasing pressure on the lungs and heart, leading to shortness of breath. This fluid retention can also cause swelling, especially in the lungs, reducing the ability to breathe. Kidney failure can also cause anemia due to reduced production of erythropoietin, decreasing the oxygen supply to tissues and organs, causing fatigue and shortness of breath. To manage this, you should limit salt in your diet, walking to improve blood circulation and respiration. We hope that the information about the 12 early signs of kidney failure after eating will help you recognize and address these issues promptly to protect your health. Early detection of these symptoms not only helps prevent serious kidney damage but also improves your quality of life. Health is the most precious asset, and taking care of your kidneys plays a crucial role in maintaining overall health. Pay attention to the smallest changes in your body and do not ignore any symptoms, no matter how minor they may seem. Additionally, maintain a healthy lifestyle with a balanced diet, drink enough water, and exercise regularly to help your kidneys function effectively. If you find this information useful, don't forget to hit the like button, share the video and subscribe to our channel to stay updated with more useful health information. Leave a comment below if you have any questions or feedback. We are always ready to listen and support you. See you in the next videos.